Hello, this is Dr. Grande. Today's question is, what is the difference between avoidant personality disorder and dependent personality disorder? So both of these personality disorders are cluster C personality disorders, so anxious or fearful. And at first, when we look at just the names, avoidant and dependent, there's this tendency to think that they might be opposite. Like avoidant could be synonymous with independent. So you have independent and dependent, so it's unlikely that somebody would have both. But actually, avoidant means something completely different. And really, they're quite similar. These two personality disorders are often comorbid, meaning they tend to occur together. So let's take a look at some of the diagnostic criteria for each of these disorders. So if we look at the Diagnostic and Statistical Manual, we see symptoms for avoidant personality disorder like avoiding occupations because of fear of criticism, fear of rejection, avoiding relationships unless somebody is certain that they're going to be liked, avoiding intimate relationships, a preoccupation with criticism and rejection, being inhibited in new relationships, feeling inept or inferior, and being reluctant to take risks, again because of a fear of embarrassment or humiliation. So we see a theme here with avoidant personality disorder where somebody is concerned about criticism, humiliation, rejection, embarrassment, and they tend to look at other people and be suspicious of their motives. They tend to believe that other people are thinking the worst of them. So when we move over to dependent personality disorder, we see different symptom criteria. We see someone who has trouble making decisions without reassurance from other people, someone who needs others to assume responsibilities, difficulty expressing disagreement with other people, again because of a fear of losing that support, difficulty initiating projects because of low self-esteem, going to excessive lengths to obtain support from other people, feeling helpless when one is alone, skipping from one dependent relationship to another. So if one dependent relationship ends, an individual will move right to another relationship. There won't be much of a gap there with dependent personality disorder in many cases. And a preoccupation with fears of having to take care of oneself, so a fear of losing support. So we see here the theme with dependent personality disorder is really this fear of not having support and this fear of having to take care of the items of daily life by oneself. So with both avoidant and dependent personality disorders, we see this feeling of inadequacy, a hypersensitivity to criticism, and a need for reassurance. So they share those properties in common. Now in terms of what differentiates the two, with avoidant personality disorders, I mentioned there's a real focus on rejection and embarrassment. With dependent personality disorder, it's more about that loss of support. And also we tend to see submissive behavior with dependent personality disorder more often than we would see with avoidant personality disorder. Now in terms of comorbidity, both disorders have comorbidity with anxiety and depressive disorders. And they also have comorbidity with other personality disorders. So for avoidant personality disorder, that tends to be comorbid with borderline personality disorder and all of the personality disorders in cluster A. So that would include paranoid, schizoid, and schizotypal personality disorders. Now with dependent personality disorder, there's also this comorbidity with borderline personality disorder, but also histrionic personality disorder. So there's a little bit of a difference between the two with what we'd expect in terms of comorbidity, but again, not a lot. And because the two disorders are comorbid with each other, that makes it more difficult to differentiate them. Oftentimes they appear together. Avoidant and dependent personality disorders also appear to share many of the same ideological factors, meaning factors we think are causal. We believe that both of these personality disorders have a heritability component which is fairly significant, meaning it's likely that genetics plays a large part in the development of both of these personality disorders. In terms of the stressors, the environmentability, we believe that neglect and abuse contribute, at least to some extent, to both of these personality disorders. So they have, in essence, a similar etiology and a presentation which is fairly similar. So why is it that sometimes these are thought of as opposite? Why does avoidant incorrectly get categorized as independent, when really avoidant is very similar to dependent personality disorder? There isn't really an independent component to avoidant personality disorder. Well, I think part of it is the name. Avoidant, if you just look at the names I mentioned, it could be misleading. And I think the other misleading component is a misunderstanding of dependent personality disorder. There's this initial tendency to understand that avoidant personality disorder has characteristics like shyness and isolation. But with dependent personality disorder, sometimes people look at that personality disorder and think, well, that individual must have a lot of friends. They have enough friends, at least, so that they can be dependent on other people. So initially it looks like we have this difference where avoidant personality disorder is associated with isolation and dependent personality disorder is associated with a lot of contacts with people. But that's really not the case. Yes, avoidant personality disorder does have that isolation component, but dependent personality disorder also has a bit of an isolation component. If we look at the symptom criteria for dependent personality disorder, we see that they require other people. Dependent personality disorder is conditional on the individual having relationships they can depend on. But in both avoidant and dependent personality disorders, there are few people there. So we have to consider the context, how many relationships someone has. So neither of these personality disorders are associated with a large social support network. The situation that somebody finds themselves in with these personality disorders is oftentimes similar across both disorders. Few friends, few social contacts, and difficulty forming new relationships. With dependent personality disorder, the new relationships that are formed tend to be one of dependency, but there's still a difficulty in forming those relationships. So when we look beyond just the name, avoidant or dependent, we see that these personality disorders are quite similar, and it makes a lot of sense that they'd be highly comorbid. It makes sense somebody could have symptoms of avoidant personality disorder and then look for individuals to depend on to try to escape concerns, worries about being left alone, worries about not being taken care of. These two are really quite congruent in that way. And it's not clear if one may contribute to the development of another. Somebody could have the symptom criteria met for dependent personality disorder, and that could lead to avoidant behavior, or the opposite could be true. It makes more sense to me in just looking at these two personality disorders that the symptoms of avoidant personality disorder probably are more likely to begin first, and then the dependent behavior would come after that. The dependent behavior in a way would be compensatory. But this isn't necessarily always the case. These two disorders can develop at the same time without the features of one really standing out. So with avoidant and dependent personality disorders, there is this tendency to think that they may be opposite. When we learn more about them, we realize there's more in common between them than we might initially think. Both are considered persistent, long-lasting conditions. Both do respond to treatment, but they also share a problem in terms of going in and receiving treatment. Obviously, with avoidant personality disorder, somebody with that personality disorder would be reluctant to seek treatment because that's another relationship. And somebody with dependent personality disorder may have difficulty forming a therapeutic relationship because of that tendency to become dependent on people, including a therapist. So there's obstacles, even if they're somewhat different between these two disorders, to actually getting involved in treatment and getting the most of treatment. However, as I mentioned, with mental health treatment, both of these disorders can improve. And also with avoidant personality disorder specifically, that disorder does tend to improve in some people as they get older. We're not really sure why that is, but research does suggest that. I hope you found this description of the differences between avoidant and dependent personality disorder to be interesting. Thanks for watching.